Hello, Georgia. Great to be with you. I'm very happy to talk to you about one of my favorite topics today, which is why we should all spend more time making really good friends with legislators. So what we're going to try to do today is give you what you need to be effective communicators to your duly elected state representatives. By the end of the webinar, we will have reviewed the difference between lobbying and educating a policymaker. You'll be able to identify your state senator or representative. We'll find out who's willing to set up virtual meetings with them, understand the importance of communicating with them, plan what to say, the problem, the story, the ask, face and overcome the barriers to communicating with them, including the hard questions, and be familiar with some V4P resources that can help you communicate. But before I start, I just want to run through, we are beset at the moment with news stories constantly saying we're such a divided country. And I would argue we're not nearly as divided as you may think. And these are really important things to think about as you reach out to legislators. We want to reach out to them on the basis of what unites us. And what are those things? Certainly the right to life, liberty, and the pursuit of happiness. And as part of this, equal access to the opportunity to be healthy throughout the course of our lives. I think we're also united around the need to protect vulnerable groups, including young people, from being deprived of these rights. So our common concerns are the basis for our common efforts. All right, quick rundown. What do we know? Alcohol, #1 mind-altering drug in the US among young people. Cannabis is #2. Tobacco is the most addictive drug we know, kills in excess of about 400,000 people a year in the US. Alcohol is the #2 killer, about 104,000 deaths a year, including close to 3,000 in Georgia. And we're in the midst of an opioid epidemic. In case you've forgotten, in the midst of the pandemic, we had 81,000 deaths from opioid overdoses in the 12 months ending May 2020. And we are anticipating, not looking forward to, but anticipating a second wave epidemic of substance abuse problems following on the pandemic. If this experience is like former similar experiences, whether those be SARS or Hurricanes Katrina or Rita or the World Trade Center disaster, these major events, what we find a year to 2 years later is a big uptick in social and substance use disorders. We need to be ready. There are a few things obviously missing in Georgia. Georgia does not have a statewide comprehensive smoke-free law that protects people from secondhand smoke in indoor areas of workplaces, restaurants, and bars. It doesn't have any state-imposed liability for hosting parties at which underage drinking occurs. This is what's known as civil social host liability. It doesn't have any increase in your state tax on distilled spirits since before 2003. That tax is currently the 37th lowest in the country. If it had kept pace with inflation just since 2003, it would be 43% higher than it is today. And Georgia has the 50th lowest tobacco tax in the country. All right, those are just a few high points, substance abuse policy issues that in my mind are worth talking to legislators about. And you can talk to your legislators about everything on this slide, and you are not lobbying. All you are doing is educating. Lobbying starts when you ask them to do something about those facts. So with federal funds, you cannot ask a legislator to vote yes or no on particular legislation. That's direct lobbying. You can't ask someone else to ask a legislator to vote yes or no on particular legislation. That is grassroots lobbying. But you can educate policymakers as much as you want until the cows come home. And if you decide to speak to them about particular legislation, you can do it on your own time. Provided you're not a federal or a state employee, you can do this on your own time. And this is what I typically do. So many meetings I've had with legislators at various levels, and I walk in, hi, my name's David Jernigan. I'm a professor at Boston University School of Public Health, and I'm here on my own time. My views are my own and do not necessarily reflect those of my employer. And they kind of roll their eyes. They've heard this a million times, and then I can say anything. Because no matter who pays your salary, you cannot be deprived of your right to petition your government for redress of grievances. So, but even on a government dime, you can highlight and translate public health evidence. You can collect and analyze data. You can publish and disseminate results of research. You can implement until the cows come home. You can do community outreach, foster coalition building and consensus, provide leadership and training like I'm doing right now, and foster safe and healthy environments. This is a much more detailed version of what you cannot do. You cannot do direct lobbying. You cannot present materials that don't include an objective, balanced presentation of the evidence. But I would never want to present materials that didn't have that anyway. You can't make materials about public policies only available to your allies or a narrow or selective audience. And these days, there's a really easy way to deal with that, which is you just put them on the web. You cannot develop or disseminate materials that exhibit all three of the following characteristics. They refer to specific legislation, they reflect a point of view on it, and they contain an overt call to action. But you could refer to specific legislation and reflect a point of view on it, disseminate that. You could, the critical thing is that number 3, containing an overt call to action. As I said, you can't do grassroots lobbying, and you cannot use government funds to advocate or to perpetuate or increase your own funding from the federal government. All right, that's what you can do. Now let's go back to what you can. And the first thing you can do is you can figure out who is your legislator. So we're going to do a little exercise here right on screen. So you can go to this address, and I already have it open. I'm flipping this in here, and I just fortunately have somebody's address, Springwater Trace in Woodstock, Georgia. If I put that address in and I search it, then it shows up with these two gentlemen, Brad Thomas and Brandon Beach. Now I want to pause for a minute. Are you all able to do this? You're at openstates.org and you're at Find Your Legislator. Let me just go back and show you how we got here. Originally, it will be just a blank, more blank screen if I go back far enough. And we're going back, and there we go. So find your legislators. Okay, so here it is.
Excuse me, David?
Yes.
I just wanted to mention that I'm still seeing the who is your legislator slide.
Okay. You should be seeing my screen. That's odd.
I think you have
all
to,
you can see is the slide.
Yes.
That is odd. Just a minute. I'm going to see if I can trick Zoom. Now, can you see the web page?
Yes.
Awesome. All right, so we're at this openstates.org, and you're going to put in your address, whatever that may be. And I think I had something like 110, that would be my home address. 114, Greg, prompt me. Or I can go forward again. There we go.
114 Springwater Trace, Woodstock.
Great. 114 Springwater Trace.
Woodstock, Georgia.
Yep. Okay. And we'll do a search. And we'll get these two gentlemen once again. And if you click on either of them, you find out little bits about them. You can get to their web page, etc. I don't want to focus on Brad Thomas. I want to focus on Brandon Beach, and there's a reason for that. So we're at Brandon Beach. He is the senator for that address. And if I load his website and I look at committees, lo and behold, Senator Beach is an appropriator. Appropriators are the ones who decide what can have money. So if this were a chess game and your state senator, Senator Brandon Beach, is the equivalent of a bishop. He's an important person, and so you definitely want to talk to him. All right, hopefully everybody's been able to do that, and I'm going to go back to my other screen.
And David, just to say, if you didn't get that whole website address, you can just Google for openstates.org, and
Very
it's
good.
really easy to do the rest.
Yeah. Okay, so then we have a little poll. Who is going to set up a virtual meeting with them? And we want to know what your level of capacity is. So Marcio, are you ready to run the poll?
The poll should be up in everybody's screen now.
It should
so
be
you can
up,
feel free to answer.
and let's everybody fill it in. And when everybody's filled in, we should be able to show you the results.
I'm not seeing the poll. Is anybody
I'm
else?
seeing it.
You are, okay.
I am, yeah.
Okay.
And we want to know, so let's see, we're waiting on the poll.
Well,
Hopefully
we've
it's
got
working.
54% of the people who
Okay.
filled out the poll yet.
Great.
So still have a little bit more to go.
Isn't Zoom wonderful?
Uh-huh.
Who knew we'd be living this much online? On the other hand, it makes it so much easier for me to come talk to you in Georgia.
Yes, indeed.
How are we doing, Marcio?
All right, we have 75% of people voted. So let me know when you want to see the results.
Well, the main thing I want to say to people is let's go ahead and look at the results. All right, can you all see the results?
Yes.
Yes, we can see it.
All right, great. So particularly these two categories, the no experience and the beginner, put your contact information in the chat. And the folks from Voices for Prevention will be very happy to help you figure out how to do this technically. It would be the worst of outcomes if all that kept you from meeting with a legislator was a technical difficulty. So just put your information into the chat and they will harvest it and be in touch with you. Greg or Esther, anything else we want to say about that?
We'd be glad to help them if you let us know you need some help.
I also put the Open States website link in the chat box so that if someone needs that, they can find it there as well.
Super. All right. So why do this? Why meet with your legislators? They work for you. You are the most important person to them really once every couple of years. And the best time to talk to them is usually when they're running for office, but after they're in office, they work for you. And you can guarantee that they are hearing a lot from the other side of these issues. I track the alcohol industry in particular, and in 2018 alone, beer, wine, and liquor companies gave $915,000 to statewide candidates in Georgia. Then here are a couple of the donors, the wine and spirits wholesalers, Savannah Distributing, which is one of your beer distributors. They don't give this money basically out of the goodness of their hearts. They give this money to buy access. The legislators will also claim that it doesn't give them influence, but it gives them access. And they use that access to tell their side of the story. And their side of the story is generally something like, The problems are going away. We do more than any other industry to prevent problems associated with our products. Taxes are really ineffective and end up punishing, the innocent, and they're bad for business. And we're good, responsible business people and community members, and we would never dream of selling our product to underage youth. Now, I have a paper that was just accepted for population where we calculate the hundreds of millions of dollars that the big alcohol companies are making off of underage drinking. There is another side to the story, and the legislators need to hear you. So what do they need to hear? Many of you may be starting a relationship with them. Some will be taking the next step with them. And the first thing to remember is that these are people. Whether you meet with a legislator or whether you meet with their staff, they are people. And it's really important to figure out how to connect with them. I worked with a guy in DC who taught me so much about how to meet with legislators. We worked the Hill on Capitol Hill on a particular issue, and he would tutor me in the cab on the way over, but none of his tutoring was as good as watching him in action. Every office we went into, he'd figured out a personal connection with that legislator. They liked the same sports team. We entered a Wisconsin one and he was in love with cheese. Whatever. The more you can find out about these folks beforehand and make a connection with them, the more able you will be to be memorable to them, which is the next point on the slide. You want to be memorable. They do a gazillion of these meetings every year. That's a technical term, gazillion. And you want to be memorable. You want to come prepared with stories. This is something the other side really can't tell. You have amazing stories. You want to come prepared with facts and a clear request, what you want them to do. And you want to come prepared with memorable spokespeople, the people who are the face of the problem. And these are often young people, people in recovery, or relatives of those who are affected by substance use disorders. What do we want them to know? We've got some big messages. Make the move from treatment to prevention. Treatment gets the lion's share of the attention and the dollars, and prevention is so much more effective if we could just fund it. And we want to make the move from programs to policies. Prevention programming is important, but policies set the context in which people make their decisions about alcohol, tobacco, and other drug use. And so the prescription for populations is very much policies, things like smoke-free laws, raising alcohol and tobacco taxes, using that money to fund prevention and statewide tobacco control programs, and those social host ordinances that make people who host an underage drinking party civilly liable. All right, another piece of how you want to communicate with them goes back to what I said at the beginning about what unites us. You want to remember that a lot of our political conversation in the US is based on shared symbols and values. And some of those shared values are things like individualism, opportunity, free enterprise, freedom, competition, education, patriotism, motherhood and family, responsibility, empowerment, fairness, equity, protection of children and the underdog, generosity, human rights, self-determination, independence, self-reliance, trust, sportsmanship. No, I'm anti-sportsmanship. No, I'm anti-freedom. You won't hear that no matter what end of the political spectrum people are on. And so we need to express what we want to see happen in the terms of these values. We want young people to grow up free from pressure to use alcohol, tobacco, or other drugs. We want to educate people. We want to protect families. We want to hold adults responsible. We want government to exercise leadership in this area, and so on. So the other thing you want to tell them is your vision. What's the world you want to see? We want to see a world where alcohol, tobacco, and other drug use doesn't ruin lives, families, and relationships, where young people aren't subjected daily to sophisticated marketing messages encouraging them to use dangerous drugs, where taxes on alcohol and tobacco are high enough to discourage use and pay for at least some of the damage. We want to have choice about the businesses in our neighborhoods and what they sell. And we certainly want, if you're going to talk about cannabis, we want what we do about cannabis guided by public health evidence and not by a private profit motive. So what do? Know whom you are persuading. And that's where you go to that legislator's website or you ask around, what do you know about this person? What do they like? What's their family like? How can you establish some common ground? And then absolutely, you want to be yourself. As Oscar Wilde famously said, be yourself, everybody else is already taken. Be yourself, you are enough. Share your personal experience, use talking points to help you. It's one of the things I love about Zoom is you can have them right over there in front of you. And it's great to do this in teams. Remember, you won't have a lot of time. They do a lot of these meetings. So be prepared, be memorable, be done. And know your ask. I'll talk about that in a minute. Appreciate them. Everybody, as far as I can tell, just about everybody feels deeply unappreciated for what they do. And you can always find something nice to say to them, even if it's just, thank you so much for fitting us into your busy day. And then follow up. Absolutely follow up. This is the start of a relationship. It's not the end of it. The follow up, anything you promise to send them, email them, your fact sheets or whatever, any promise you make to a policymaker, always keep that promise quickly. That's, as I say, the beginning of a relationship with them. What they will be listening for is what you want them to do. So you need to be clear about what your ask is. There's some relatively soft asks. You know, gee, we're meeting with you to raise your awareness about these issues. We want to make sure you're educated about them. We want you to take some time to visit with us when you're in your district, see the work that we do. And we want you to stay aware of pending substance abuse prevention legislation. We want you to take our needs around community substance abuse issues and related legislation really seriously. And we want you to act in response to what we're telling you about what are the most pressing local and statewide substance abuse prevention needs. Those are some soft asks. Those are, they will nod their heads, their smile, etc. Here are some slightly harder asks, and they will really be looking for these. So you could ask them, why is it that Georgia's tobacco taxes are the lowest in the nation when we have major unmet needs for substance abuse prevention and treatment? Can you help us understand why these taxes are so low? Are you aware of how effective civil social host laws have been at the local level? And could you think about what implications this might have for the whole state and what things might be like if everybody were covered by one of those? How much better protected our young people could be? Would you consider adjusting Georgia's tax on distilled spirits for inflation and using those funds to address the state's substance abuse problems? Or whatever your priorities are, but you need to think about your priorities. They will be listening for what you want them to do. So then you just need to stay within the lines regarding lobbying. The ideal meeting, to my mind, has 4 short, well-prepared and practiced presentations. And I have seen young people do this. The young people from Dover, New Hampshire are incredibly well trained. I understand you're bringing them in to do something in Georgia. They're amazing. They have everything on index cards and it is clear they're well prepared. Those 4 presentations, the first one lays out the problem. The second one tells a personal story. The third one talks about what works to prevent the bad things that happened in the story. And then the fourth is the ask. What do you want that legislator to do? Now, there's a classic old joke. How do you get to Carnegie Hall? And the answer is practice. Practice, practice, practice. Okay, so the next thing I want to do is a little exercise. I want you to have a chance to think about this in pairs. And Marcio will do these for about 3 minutes, 6 minutes total. You'll be in pairs, and we'll let you know when 3 minutes are up. This is kind of a listening exercise. One person is the listener, the other person's the talker. The listener's job is just to be really, really encouraging and enthusiastic about what the talker is saying. What the talker is doing is starting to plan. What are you going to talk about? What are your facts? What is your story? Who should your spokesperson be or people be? And what's your ask? So I hope it's clear on what we're about to do. And let's, Marcio, can we go right to the breakouts?
Absolutely.
Again, we'll let you
Starting
know
breaking the
when
room
to
now.
switch roles, talker to listener, and start your plan.
And because we're in an odd number, just give me a quick second to organize those rooms to make sure that nobody is alone.
No worries. Anybody that's alone, you can put in with me.
All right. And opening the rooms now.
Great. Is Marcio here? Greg, somebody, I need to get a message to the rooms that it's 3 minutes and they need to switch.
Okay, Marcio?
Okay, I can do that. I'm actually one of the hosts as well. I can, it says
Awesome,
broadcast
great.
message to all. So I
To
say,
all, just switch. That's 3 minutes, switch roles. And can you put me back in room 11?
that's.
I can do it. I can do it.
Okay, let me do this.
Amanda and Megan, are you still on?
It seems that Megan is supposed to be in room 9 with Jolanda.
Megan, can you hear us? Marcio, if you can hear me, I'm seeing Megan and Amanda still on my screen.
I can hear you, Greg, and I see that Megan did not join her room with Yolanda. And who else? Amanda didn't join her room with Xiomara and Cassandra. She was one of the ones that went to a 3 people room. So
Okay.
and John Bringle just asked for help. I joined his room for a second. He when people went to their rooms, they don't have the visual of the slide with the questions. I was wondering if I can get those questions and just send to everybody as a message. I have the option to do that.
Yes, you could do the broadcast message to all.
Right.
Yeah.
But I needed the questions to.
Oh. He just went over it. It was really just kind of a practice of conversation. Those 4 points he just went
Right.
over.
So
They
let me
weren't
know
really
whenever,
questions.
if we're good to close the rooms and bring everybody back. I can
Let's
do
give
that.
them a couple more minutes because we just told them to switch.
Okay,
So yeah, I think let's wait for Dr. Jernigan to come out of the room.
and then we'll bring everybody back. I'll stand
Yeah.
by.
If we do a second breakout session, which I think he may do, that's a great point, that to have the question somehow typed
So
out.
basically, if I can just have a text of the questions, I can broadcast a message to all the
Yeah.
rooms. So,
So
but I need the
I
text to
will try
copy.
and type out the question as quickly as we can and put it in the chat box.
Yeah.
Perfect. Yep.
Yeah, the broadcast. Greg, I got a question about the slides that I haven't answered yet, but I imagine that they're going to be made available after. I did mention to the individual that asked me that we're going to have the recorded webinar on our V4P webpage. I imagine we can also say that the slides will be available there as well.
Yeah, maybe we could just edit out my home address. If that's going to be, put on the internet. Don't feel so comfortable with having my home address on the internet, just in case if we could edit that part out somehow.
Okay.
Absolutely.
Yeah.
All
right. That's fine. Yeah. If Dr. Jernigan is giving us permission.
He is back.
Back.
He's muted, but he's back.
David, do we have,
let's bring them back.
Okay.
What do you need?
do we have permission to use your slides on our
You
website?
do. You do.
Thanks.
Yep.
All right. I'm going to close all rooms. That'll make everyone come back, right?
Okay,
Yes.
doke. They'll be in shock.
55 seconds. Okay.
Okay, so they have a little bit of warning.
Yeah.
All right, and I'm going to go back to sharing my screen.
Dr. Jernigan, I've got a few questions from people that, since the slide didn't go with them, some of them were asking for the questions.
Okay.
If we do have another breakout session and there are questions, if you don't mind, just copy and paste, or we can just type it out real quick so I can broadcast to all the rooms.
Yep. I just
Oh,
stuck it
there
in
we
the
go.
chat.
Is that for the next one, or that's for
No,
the?
that was for this one. The next one's a little easier for them.
Okay, great. Thank you so much.
You bet. No problem. And we're slowly coming back.
A virtual platform.
And I'm gonna share my screen again. And we're gradually coming back. Good. I hope you all had a good time talking with each other. I had a great time talking with Aussie Rebels, who has a great story to tell.
Hey, this is Veronica Dow. I tried to talk to Lethea, but I hope that's her name, Brian. But for some reason, our volume, nothing would work or anything. So we started returning chats in the chat box, going back and forth.
You were very creative.
Yes.
Yeah, everybody starts out on mute. You got to figure out how to do that mute button, and beyond that, it's all in the mystery of Zoom. All right, let me just share a little more with you, and then we'll do another quick exercise. So I am motivated by hope when I do this. So much has changed just in our lifetimes. If you look at tobacco, things are so different there. And I love this quote, hope is like a road in the country. There was never a road, but when many people walk on it, the road comes into existence. And I argue that what we're trying to do is build roads for our young people, build roads of possibility, of safer lives. We're also at the start of a journey with our legislators. And we have to be animated by a sense that we can do this, that we can do things like raise their awareness about the role of price in young people's drinking and tobacco use, that we can raise their awareness about how important it is to make these substances less readily available, to reduce young people's exposure to the marketing for these drugs, make adults responsible for the choices they make that affect our youth, maintain and strengthen effective drug control systems, shape tobacco and cannabis environments so they protect youth and other vulnerable populations, and really importantly, win allies and make prevention work. You all have great stories to tell, you have great facts, and you have terrific materials that Voices for Prevention has prepared for you that they'll run through briefly for you at the end of the webinar. But I'm going to put you back in those rooms. This is going to be a quick one, 2 minutes each this time. And here's what I want you to do. I want you to think about what's the question you're most worried you'll be asked by a legislator or their staff. And then I want the two of you to think together about what the best answer to that question is. This is part of preparation. This is role playing. And it's so much better to do it than when you're in the situation and trying to think on your feet. We'll do this briefly, and then we'll come back and we'll have just a little bit of time for you to throw some of those questions at me, and I will model how I would answer them. So you want your answer to be factual, based in your values, true to your experience. So
David,
Marcia, yeah.
Reiterate what the two questions are that you want them
It's
to.
only one question. It's just, what's the question you're most worried you'll be asked by a legislator or their staff? That's all. What are you
Just to
most
confirm,
worried somebody's going to ask you in one of these meetings?
Dr. Jernigan, just to confirm, we're doing two
Twosomes.
persons per room.
Yep. Same
All
thing.
right. Copy
Yep.
that.
Let her rip. All right. Hello, can somebody broadcast switch roles? Yes,
Marcio, can you do that?
Yes, I'm sending the,
thank you. And let's bring them back.
all right, closing the room. All breakout rooms will be closed in 55 seconds.
Great. And now we want to monitor the chat for their questions.
And as soon as everyone's back, we just got one question in the chat box.
Great. What is that question? Let's see.
Questioner worried about specific data. How do you answer specific questions concerning data, concerning statistics from legislators?
Okay, I'm not seeing that question, but that's all right.
It was
Can
to
you,
everyone from Tara Sanders, bottom. But that was the question.
okay, all right, I can speak to that.
Okay.
Okay, it looks like we're back, and I hope you had fun doing that one. This is an action-packed webinar. And if you can, bring yourselves to life so I can see you. If you've got a camera, let me see you, because this is the interactive part. And I want to be able to look at your questions in the chat or call on you if you want to speak up. We had one that was about using data with legislators. My approach to data is always to have the little fact sheet in front of me so that I'm sure that I get it right. The reason that we use data is because it's very hard to get where we want to go if we don't know where we are. And the data are our best sense of where we are. We're going to get better at collecting the data, but this is the best we've got at this point. And even though everything we do could be improved, the data give us a picture at this point, particularly with things that are self-reported, like underage drinking, like smoking, tobacco use, etc. People tend to underreport. That's okay because we use the data primarily for trends, and we generally assume that people will be underreporting consistently over time. So we can trust the direction of the trend more than a specific data point. So what are additional resources in your community that you use to assist with this issue? So if I were asked that, I would talk about having a broad coalition of folks. I would talk about everybody that my program worked with. I would be trying to give the legislator as big a sense as possible of the numbers of people who are working on this, because legislators are all about numbers. They're all about thinking about the next election. And the more you can show evidence that a lot of people care about this, the more influence you're likely to have with them. We don't have money like the other side has, but we have numbers. We have people. So for instance, when I go to Capitol Hill in DC, I never go alone. I always bring somebody like Sue Thaw from Community Anti-Drug Coalitions of America. She represents 3,000 coalitions nationwide. She represents big numbers. And of course, I always, if I'm going to a specific member, I try to go with people from that member's district. What other questions do you have? Anything that came up in the chat that stumped you? And go ahead and unmute yourselves and speak up or stick it in the chat. I am your resource.
Those are all the questions that we have in the chat at this point in time. So if anybody has an additional question, please unmute yourself and let us know or put it in the chat.
I have a hard time believing that you are not worried about anything that the legislator could ask you. Why is this issue so important to you? Great question, and a real opportunity to get personal. This is something you need to decide about your comfort zone, but personal stories are more memorable than facts. Facts are sort of the bedrock, and then personal stories are the memorable buildings that we build on top of the bedrock. Why is this so important to you? Because I care about my children, because I care about my grandchildren, because when I was in college, I saw classmates wasting their future and their potential because of use of these substances, and I just think it's such a terrible waste. And so on. Whatever you can do to make it personal will, again, help you be more memorable to that legislator. Probably the worst answer to that is because somebody's paying me to come talk to you. I wouldn't use that one. And what I do sometimes say is I can make a lot more money doing something else, but I'm not in this for the money. I'm in this because I care about my community, and in particular, I care about young people, or I care about young people of color, or I care about whatever it is that you can make a credible case that you care about. We've got about another minute we could take. Here we go. When I speak with legislators, they seem to be concerned with bigger issues. Our community has a high rate of youth and gang violence, for instance. Even though there are shared factors, it's difficult to get them to take underage drug use seriously. So this is a really handy one to have some facts. 47% of homicides are considered caused by alcohol use. Okay, that's almost half of the murders. Similarly, high levels of violent crime. If you've got a violence problem with young people in your community, it's a really good chance you've got an alcohol problem. And one of the things to say to the legislature is, I'm really glad you care about youth violence and gang violence. And we got to get behind that. We have to look at the factors in that make it worse than it needs to be, or worse than it would be if those factors weren't in the picture. And having alcohol so widely available and so cheap, and I mean, we have one of the lowest distilled spirits taxes in the country. It's no wonder our kids are drinking too much and getting into trouble. That's how I would wrap around that. Great. By my clock, we've got about 2 minutes left. I'm going to turn it back to you, Greg and Esther.
Okay. Thank you so much, David. Just a great presentation. And so just want to tell you again what Esther has mentioned about some advocacy resources and upcoming events, and what will be ready very shortly, and we can email you those, and we can also put them on our website for you to find. We'll let you know as soon as they're available. We have discussion guides that you groups of advocates can discuss amongst yourselves on alcohol, on prescription drugs and opioids, on marijuana, and so forth. So those are available to you to help you create your own local fact sheet for legislators. And that's the second sheet that we've got. We've got a generic one that you can take and tailor, put your own logo on the top. If you want to keep ours, fine, but put your logo on the top. The final editions of these two one-pagers will be filled with graphics, because graphics really help get the legislators' attention. And if it can be a mix of adults and youth that are visiting the legislators, they really enjoy listening to the youth. So lastly, I wanted to mention our advocacy toolkit. That is available at no cost to you. It has some great tips in it for adults, for youth, and for adults who are youth advisors to youth action teams. Can tell you the fundamentals. Also, if you're in the intermediate stage, it can be valuable to you as well. There's a certain section that's addressed specifically to youth advocates to give them the tips they need to confidently interact and meet with their legislators. So with that, I will turn it back over to Esther.
Thank you, Greg. And I wanted to mention, I put, and Marcia also put, the website link in the chat box where you can get all of these resources. You can also sign up for the upcoming events there on the web page. I want to make sure that everyone understands we still have some of the documents from last year's event. So the ones for this year, we're still in the process of making those, of finalizing those. And again, as Greg said, making them more like infographics to make sure that they're more appealing and easier, more user-friendly, I guess I would say. So those will be coming out, and we will have them in on our webpage. The best way, and I will say this again, the best way for you to stay on top of receiving these and knowing what's coming up is becoming a member of V4P. Go to our webpage, top right-hand corner. That's where you become a member, because everything that we send out in terms of any type of legislative updates, any type of activities and webinars and resources, that's how you will get that. So again, the link is there on the chat box. Please feel free to go there. If you need help, again, setting up the appointments or have some issues with not knowing the technical side of it, I'm with you. I am really slow with that. We have a team though, and this team can help you set those appointments and help you navigate that part of it. So please feel free to leave your information in the chat box. You can also email me. I am going to put my email in the chat box as well, so that we can reach out to you individually and help you out in any way that we can. The final thing tomorrow, just a last plug, tomorrow we have our first topic discussion. We will be discussing marijuana and alcohol in preparation for our advocacy day. And that is at 2 o'clock tomorrow. Go to the website. There is a place at the very top of the page where you can register for that event, as well as register for Advocacy Day in March, on March 9th. And I think I announced everything. I don't think I missed anything. If I did, Greg, Xiomara, let me know.
Very good.
And
Terrific.
definitely did great.
Terrific. I am cheering you on. This is what we're trying to do. I'm inspired by the Southwestern artist, Georgia O'Keeffe. This stuff is scary. She wrote, I've been absolutely terrified every moment of my life, and I've never let it keep me from doing a single thing I wanted to do. We can do this. You can do this. I'm cheering you on. Never doubt that a small group of thoughtful, committed citizens can change the world. We are those people. You are those people. Have great meetings with your legislators. Thanks. I've got to run.
Thank you.
Bye-bye.